Hi, I'm Dr. John. I'm a psychiatry resident and an advocate for mental health education and services for all. So today's topic is based on a viewer request and it was as follows. Dr. John, thank you so much for your informative series. Please, in one of your sessions, teach us about Pica. I'm starting to worry about how much soap I eat. So today I'm here to talk about Pica. Pica is an eating disorder, and it is basically a persistent eating of non-nutritive, non-food substances over a period of at least 1 month. It is only considered a disorder if the eating of non-nutritive, non-food substances is inappropriate to one's developmental level. What do I mean? You find a 6 months old trying to eat soil, trying to eat, put anything in their mouth. That is not Pica. If you find an adult female trying to eat a sponge, trying to eat soap, that is when it can be considered Pica, and that is if it has gone on for a period of at least 1 month. In addition, if this eating behavior is considered culturally appropriate or socially acceptable, then it is not called an eating disorder. If you're in a society where they eat non-food substances, maybe cotton or maybe clay, and it is culturally accepted, it is socially accepted, it is normal in that community, then we don't say you have Pica, because that is just a habit you've learned as normal. In addition, if the eating behavior occurs in the context of another mental disorder in which we may expect to find such eating behavior, for example, intellectual disability, autism spectrum disorder, schizophrenia. If you find a schizophrenic on the street eating garbage, or if it occurs with another medical condition, including pregnancy, it is only considered a Pica disorder if it is severe enough to warrant additional clinical attention. So, what are the risk factors for Pica? Risk factors for Pica disorder include things like developmental delay, child neglect, lack of supervision in childhood, lead poisoning, and so many others, but most commonly iron deficiency or zinc deficiency. You may actually have had quite a number of pregnant women craving for soil or eating for soil. This is because usually in pregnancy, levels of iron are low. Soil contains iron. So Pica is like a cry for help, the body desperately demanding for what it lacks. But other times it is the mind trying to relieve anxious and stressful feelings. So you may have had experiences like childhood neglect, and the mind is trying to protect you from these stressful events. So you constantly find yourself chewing on non-food, non-nutritive substances. So, what is the treatment for Pica? Unfortunately, there is no medical treatment for Pica disorder. We basically treat the underlying cause. Treatment is to address the predisposing factors. If you have iron deficiency, zinc deficiency, lead poisoning, you're treated accordingly, depending on the results from the lab investigations. Treatment is also meant to address the socio-psychological stresses that are predisposing one to Pica, like child neglect. So, if you have Pica, please see a psychiatrist for assessment to have the various issues addressed. Thank you so much for listening, and if there is any topic you would want me to talk about, please feel free to ask in the comment section. I'll be very glad. Don't forget to subscribe, don't forget to comment, don't forget to like, don't forget to share. Until next time, bye.